So we have our patient here with a trigger point in her left masseter. So we're going to pin down this trigger point, and I'd like to dry needle right into that trigger point. So we're going to try manipulating the needle a few times to get a couple therapeutic twitch responses. And then we'll use our E-stem here to stimulate that, just to get a retraining to the muscles right there. Okay, so generally with our TMJ patients, we're going to see them consistently for a few weeks. We want to try to get their muscle tone and joint movement back to a baseline. Once we've achieved that baseline, it may be appropriate for that patient to come back a few times during the year just to do some fine tuning. So if they did get a good response to dry needling or soft tissue work, they may just come in for a handful of visits later in the year to get them back to back to the baseline if they have a flare up. But some of the things we want to do with our patients is some postural education. We're going to talk to them about that up front on their first few visits. And a lot of times there's a big interaction with the cervical spine with the TMJ, and so we're looking at joint mobility, especially those upper cervical segments, and then also normalizing the joint mobility of the TMJ. So this is a great treatment. We don't typically use this in isolation. It works really well with other interventions that we do, such as the exercises and the joint mobility. But generally we get a good result, a very good response, specifically if it's involving the masseter muscle or other muscles like the medial and lateral pterygoids.